Guys, welcome back to Medical Coding with Blue. Today's episode is all about mistakes to avoid while medical coding job seeking. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, so I got this message from a viewer who has their Bachelor's of Science in Nursing, their CCS, their CPC, and their CRC. Looking for some advice. So here we go. So the viewer says, I left the job biller coder position from a private provider's office after relocating to a different city where my husband and I purchased our first home. I applied almost every day after finishing renovation work there and submitted at least 10 applications a day, sometimes 20, and I still tried to keep on applying at the same effort. I received 3 interviews so far. One was from the local hospital. I passed all the interviews and took the assessment test. The test was a combination of fill in the blank and multiple choice. I got a 78 on this test. I answered correctly all the fill in the blank questions, but got wrong some of the medical coding questions because I thought too much. So I reached out to the hiring managers as I think I failed the test. They replied to me that there is no passing score for the test. I know that there were many candidates who applied to that position. After over 2 months of that process, I came to know that I was not selected for the position by checking on the hospital website. They didn't send me a rejection email and also didn't reply to my follow-up emails, including requesting email for the feedback. Another 2 interviews are from the health plan and physician ASC group. I did well on the first interview, although the recruiters said they are going to pass my resume on to the hiring managers to be selected for the second interview. I received a rejection email in the following day. Also, this means the hiring managers didn't select me. I know I do not have 2 to 3 years of experience that they're asking for in the job application, but I don't know why I was stopped there because they didn't reply to me for my feedback emails, and I think my resume is not bad, although it is not perfect. So this was not the end of this email, but I'm going to break this email off into some other episodes. There's 2 episodes that I want to talk about from this email in particular because there's more to this email. But I will say this first. So when you're applying for a medical coding job, whether you're brand new and you're trying to get your first position in the door and you're just like, what do I do? I did a video last week about places to apply. I always encourage you guys to apply directly with the hospitals that you want to work for, urgent cares or nursing homes, things like that. I want you guys to apply directly with those places. Stop wasting your time with recruiters. Recruiters are not looking for you when you have no experience. They are looking for people who have experience because recruiters are looking for a specific criteria that whoever hired them to headhunt is looking for this specific criteria. And if they bring to them people who don't fit this criteria, that person is not going to be employed as a headhunter for that company for very long. So quit wasting your time with recruiters, okay? It doesn't matter what those recruiters say. You need to be the one in the driver's seat applying for these jobs. So one of the first things that I noticed is that the person said that they are applying 10 applications per day, sometimes up to 20. So this tells me that you're applying to a lot of places. And sometimes when you do this, you're applying indiscriminately. You're just applying everywhere. And I'm figuring, because a person said that their resume was okay, but it wasn't the greatest. I figured that you're not updating the job title on your resume that you're looking for this particular job at this facility. Because if you're just sending out a resume that says you are a medical coder, congratulations. I don't care. What position are you trying to apply for? Because medical coder could mean several things in a facility. It could mean the profi coder. It could be the outpatient coder. It could be the inpatient coder. It could be any of those things. Coder 1, coder 2, coder 3. So if you are not looking at the job listing and making sure that job title is in your resume as this is the position that you are applying for in your objective statement, right? Because you have to have your professional objective. Now, people will argue about this. I'm a professional resume writer, guys. I have written a lot of resumes, and resumes that have been successful in getting people jobs. It's never a guarantee. But what I am saying is this. When I do write a resume for somebody, I am looking at what skills are they bringing, or they're trying to bring to this organization, number one. Number two, what position are they looking for? A lot of times people, and I've done tips, videos on resume tips for if you're going to write your own resume, which you totally can, guys. You don't have to pay somebody to do it. I've said it many times, the way that it needs to be is one page. Don't, send out 2, 3, 4, 5 page resumes. I've seen that. And people with a straight face on LinkedIn will tell somebody who has a 5-page resume, oh, it looks great. Either you are lying to them or you literally don't know, and you're giving this person a false sense of confidence in what they're trying to put out there, guys. The thing is, these people who are looking at these resumes, they have very little time because they're often getting lots of resumes from people. So they will look at things and they will eliminate people immediately for the smallest thing. And one of those is having more than 1-page resume. Now, you can go up to 2 pages, but really, if you are brand new to this industry, there's really no reason for you to have 2 pages. Doesn't matter what you've done. Doesn't matter how many jobs you've had. You need to just focus on having a 1-page resume. Your name needs to have a comma with your credentials next to it. Okay? Because a lot of times I'll see people that when they come to me for a resume rewrite, they'll come to me and they'll have nothing about their medical coding training, but they'll have their previous jobs. And where's your credentials? Your credentials do need to be on your name, okay? And you don't have to have 50,000 skills listed. And especially if you have that you're organized and you're a team player on your skills list, I would reject your resume immediately, because your skills list is all of your hard skills. What are hard skills for medical coders? That is ICD-10-CM, CPT, HCPCS, ICD-10 PCS if you have that. If you are showing laziness, which is ICD-10-CM/PCS, that's laziness. Again, another reason that I would immediately reject you, because this ICD-10-CM and ICD-10 PCS are 2 different things, and they require 2 different lines, okay? They don't need to have it be doubled up like that, because again, it just shows laziness. It's not being efficient, it's lazy. And then it's your medical terminology, your anatomy, pathophysiology. Those are the things that need to be there. And for those that say, well, I don't know what they're looking for, the job listing often has a specific list of all the things that this employer wants. And some of these things are very basic. So leaving off extra things, like, if people are going to do that ICD-10-CM and ICD-10 PCS, CPT, HCPCS, and then they say medical coding, and then they say medical billing. The medical billing one I can understand, but medical coding, you just have ICD-10, CM, and CPT. What do you think that is? If somebody knows how to do that, what do you think that is? Coding. So that doesn't need to be included, I'm just saying. So some of these skills are being doubled if you're adding all these other things in there that don't need to be there. We need to make things as clean as possible. That's why it needs to be on 1 page. Your work history only needs to go back 10 or 15 years. And if you say, well, Blue, I did some home health stuff in the early 2000s, and I want to put that on there because, I was doing a lot of that medical records thing back then. It's not going to matter, because you're not going to remember all the things that you did from way back when, okay? The technology was different back then in the early 2000s. Laws were even different back then. And of course, they didn't even have ICD-10 CM for reporting in general. They had it for other places and other things, yes, but not for the standard of coding. It was ICD-9 back then. So that's something that you have to consider, okay? Only go back 10 to 15 years. And if you say, well, I have a gap in my employment, if you have been a stay-at-home parent, that is not a gap. That is, you are raising children, and you need to put that on there, that you are a caregiver. And you need to put down on there those things that, what do you do when you're a caregiver? You make sure that you pay attention to everybody's health histories, right? That's something that you need to pay attention to, because you do have extra skill there, okay? If you were a volunteer with the PTA, you helped to organize events, you handled cash, you protected private information. Again, things that you could put onto your resume, okay? Just because you volunteered, whether it is with the church, whether it is with the school, whether it is, with some other program or at the library or whatever, it doesn't matter, guys. It's what skill are you bringing in from that? What can be transferred over? And clearly somebody that is protecting private information, that's a transferable skill. Somebody who has used, Word or Excel, again, another transferable skill. So that's the thing that we need to think about when we're looking at these resumes. And if you say, well, Blue, I just don't really do a good job, on a resume. Your resume has got to be right, guys. That's the biggest problem with people just sending out a resume willy-nilly and not really paying attention to what's in the job listings. You can just go and look up medical coder or health information professional or health information management, and you can look for those coding job listings and see what's in those job listings and see if some of those things can be incorporated into your resume as far as like the skills go, okay? Protecting private information and HIPAA and those kinds of things, because those things are very important. And again, if I'm having to sit here and do an Easter egg hunt looking for what credential that you have, because your credential is going to tell me, if I'm a hiring manager, it's going to tell me right away, this person knows inpatient coding and they know outpatient coding, or this person only knows outpatient coding, which may be fine for the facility and what I need, but you never know. So again, that's something that you have to look at when you're presenting yourself on your resume, because again, your resume is your mouthpiece. That is the one thing that's going to be able to speak for you while you are not there in front of this person. You are sending this in for them to look at. And your cover letter is going to be the one that's going to have your soft skills like organized and team player and that kind of thing. It's not going to be a regurgitation of your resume. And that's another mistake a lot of people will do, is they'll talk about everything that's on the resume, they'll put it on the cover letter. And that's why a lot of people don't read those cover letters. But the cover letter is that human connection and that draw of what you're going to be able to bring over into this position, and that you're serious. It's going to show that you're serious. It's going to show that you understand the assignment. You know what you're about to walk into, even though this may be your first job. It doesn't matter. A well-written resume that is conveying your skills is really going to help. So having a dismissive attitude about, well, my resume is okay, but it's not the greatest, that's part of your problem, why you're not getting hired. So either you need to look at your resume again and get it down to one page and work on that, or you need to hire a professional to do it. And when you're hiring a professional to do it, you need to carefully consider that professional, because there's a lot of people out there that proclaim, oh yes, I'm a professional resume writer, and they don't know anything about our industry. Make sure they know about our industry. And if they say, yes, we do for medical coders, you need to look at what are they saying. Is it being concise? Are they repeating themselves and that kind of thing? That's what you also need to look for, because I've seen those as well. People who say, oh yes, we write for health information all the time. And when I look at those resumes, I would not hire that person either, because they're repeating things are not right. And I'm just like, I wouldn't. Not me. Yeah, I would not do that. But it's entirely up to you guys. But again, if you're getting minimal contacts because you're sending out a bad resume, that has a lot to do with it too. All right, so that's just something that you ought to know. There's tons of resume writers out there. You can get on LinkedIn. You can ask for recommendations. I am a resume writer myself. My rate and contact information is in the description box below. But I will say that I will never guarantee my resumes, but what I will say is this: people have been successful. They've come back to me and say, well, Blue, I didn't get any calls, and as soon as I started sending yours out, I started getting calls. There's a difference when the person who's writing it really knows what they're doing, okay? And again, I will never guarantee my resume, but I will say that what I do is I meet with my clients for 30 minutes on Zoom before I do anything. We meet together, and that's part of the package. You said you get 30 minutes with me on Zoom. We discuss what you want and what you absolutely have to have on that resume. Because what I will not do is I will not go back and forth with you on your resume. I'm the resume writer. I'm a professional and I know what I'm doing. I don't need to go back and forth and, oh, change this, change that. No, that's why we have a meeting. That's why we meet together and you tell me what your needs are. You tell me what you're looking for. If there's something that you absolutely do want on there, we talk about it because it may or may not be necessary. I've seen people who want to have all their awards listed. Guys, employers are not looking for awards. They're looking for skills. They're looking for skills. That's what they're looking for. And can you convey this in 10 seconds or less? Because that's about as long as they'll look at your resume if they're not interested in it. But if you start grabbing their attention with a well-organized, well-laid out resume, that's when you're going to be able to get them. Okay, this is the person we want to look at. This is the person we want to meet with. Okay, so that's the thing that I will say about that. But I am booking for January 2025. So if you're interested, again, my rate and contact is in the description box below. But you have to have a really good resume. And I do have videos where I give my tips on those. You can go through my videos. Don't ask me to list the video because you can go through my videos. It's been fairly recent as well. But that aside on that one, don't indiscriminately send out your resume. You need to make sure that you are updating your resume to the job title that you're applying for, and that when you're doing this, you're not going through a recruiter. You're going directly through the hospital or directly through the organization that you're trying to get into. If you're applying at a hospital or you're trying to look at the hospital that is in your area and you don't see any positions for a medical coder, call the HR office and ask them, do y'all have a company that does your medical coding? And if so, could you please tell me who it is? Because I'm interested in applying for a coder position, but I want to know who I got to apply through. A lot of times they will be happy to tell you who it is. You find out that company's information, you apply directly with them. Again, even though they're asking for experience. Because if they receive a well put together resume, they will look at you. And if they're desperate enough, they'll send you a test, an assessment test, which leads me to the next thing on here. The person got a 78 on the test. You have a Bachelor's of Science in Nursing and you have a CCS. There is no reason at all you should have got a 78 on that assessment test. None. Because that CCS says that you have mastered medical coding. Now, being a little bit higher than that, I could understand. Being in the 80s, I could understand. But a 78 is very low. And that would tell me, as somebody who's in the hiring department, that this person is not ready for the real world. This person is not ready for our setting. And they said they had experience working as a biller coder for a physician office, but trying to get over here and you only scored a 78, then you need to work on your coding. You need to go back to the workbooks and you need to start working through the workbooks again, so that when you do get out there and you're still getting those assessment tests, you will score better. Because a lot of times when these organizations are going to take a chance on somebody new, and they get something like this is why they say they don't want to hire people who have less than 2 to 3 years of experience, because of things like this. They don't want to be somebody's guinea pig. They don't want to be your training wheels and where you learn at, because then that means you're going to be making a lot of mistakes. However, the person who scored higher, maybe they scored a 95 on their test. Well, this person doesn't have a lot of experience, but they did work a little bit before. But we can give this person a chance because they clearly know what they're doing. And somebody who scored a 78 is telling me that you don't know what you're doing. Okay, so if that's you and you failed your assessment test, then you need to go back to those workbooks. There's no excuse for it. You need to know at least the basics, because some of these tests you can't really prepare for, but what you can do is know your basics. Know the basics of the coding guidelines, know the basics of the coding conventions and things like that, like your sequencing and things. You know those things and you're going to be okay. But I will say this, asking them for feedback repeatedly sending them messages afterwards, asking for feedback and things like that, often they will not send you feedback because, again, they're just giving you a test to see if you could pass their assessment test. And if you can't pass that, they have no obligation to continue to have a conversation with you. However, if you got the test and you got a 78 and you say, would you mind if I take this test again? I was just really nervous and I really want a chance to show my skills here. Would you consider letting me have another chance to take this test? Sometimes they'll say yes, sometimes they'll say no. But if they say yes, and of course you score about the same thing again, then they know you're really not ready. But again, they don't have to. That's a choice for them because it is their organization. And when you're hiring somebody, it takes a lot of money, guys. This is not a game. It's not a game. It takes a lot of money. They have to get a background check on you, and that costs the organization money. They have to send you for a tinkle test. That also costs the organization money. Then they have to train you, which means that you are not fully up to speed yet. They have to wait at least 90 days for you to be fully up to speed. And then at that, you may still be struggling at that 90 days. Okay, especially if you have limited to no experience. So you're asking the organization to give you a lot, but you have to be willing to give a lot back to the organization. This is why knowledge is such a key part of being a medical coder. I tell y'all all the time to go back to your workbook, and people are still looking around for the answer. They're still looking around, what do I do? What do I do? You go back to the workbook. If you don't understand, you need to work and get that practice in. The practice is what is going to help you to get your confidence and to get you to be understanding of, again, what you're about to walk into. Okay? But you never repeatedly send emails to the place asking for feedback about what you did wrong. It's not up to them to have to explain it to you. This is the real world where no one will give you the answers. No one will give you the answers. And you can ask, and again, I don't know, but she did make mention quite a few times that she had asked for feedback. I would not give you feedback. If you repeatedly asked me for feedback and then they told the person that there wasn't a passing score, it's just that she did not meet their minimum expectations. I mean, that should have been sufficient enough. But to keep hounding the people, wanting feedback, that's guaranteeing that you're not going to get a call. Not for me, at least. Because when I say something once, I expect the person to understand. Like, oh, I'm sorry, get more experience and come back to us. Or, we're not hiring at this time. Or, we're going to send your resume on to the next, to the people who are managing the department. And if they deem that you are not a good candidate based on what you have there, because again, the recruiters and HR only have limited knowledge. It is the health information manager and the supervisor and everybody else that's looking at your resume that's going to know. Okay, so you may have made it past in the first interview. Okay, so just enough just to get you in, all right? But I mean, it's up to the second group. And if that second group deems that you are not ready yet, or you don't have enough skill, or you don't have enough knowledge based on what you have there on your resume and your cover letter, that's their prerogative to deny you to work there. Because again, they have deadlines they have to meet with the coding as well. And again, they're going to need somebody who's going to be able to come in there and hit the ground running. And people who are brand new have been able to do that. But again, these are people who are very special because they have taken the time, they have listened to people who have given them that advice of like, you have to study, and people who have taken it seriously, not people who are just, getting frustrated or assuming that just because they have a bachelor's of science in nursing that they don't have to worry about all that stuff, that is going to come easy to them. My nurses, this is a big thing for them, that a lot of people will tell them, oh yeah, you're a nurse, medical coding should be easy for you. And I always have some nurse who gets upset with me and sends me nasty messages afterwards. I'm letting you guys know the truth. I don't want you guys to be set up for failure. I don't want you to be taken advantage of. And I don't want you to walk into a place thinking that you know and you don't know. And selecting codes from a super bill does not a medical coder make. Okay. And that's what a lot of nurses have done. And I used to correct the codes. Okay, well, you corrected the codes based on a list of codes that you already have that is common to, supposedly common to your practice. Well, does it necessarily mean that that was what was happening there? Unless you have a certified medical coder who has experience and who has been able to correct that. That's the whole question about it. I don't stroll in to a nursing unit and say, oh, I know all this about nursing just because my medical terminology is advanced, just because my anatomy is advanced, just because I know pathophysiology. I'm not going to do that. Just because I know pharma, I'm not going to stroll up in there and say that, oh yeah, I can be a nurse. I would never do that, because I have no desire to ever be a nurse, and I have no desire to do any of those things. But again, you need to get into it for you to understand what this is. And everybody starts off at the bottom. Nobody starts off just because you have past medical experience. It does not mean that you're going to easily transition over to coding and that you're not going to struggle, because we all struggle. We have to know what doctors know while never having gone to medical school. And while nurses have a clinical background, and that's good for them because it does help, it's not everything. It's only a part of the puzzle. Okay, so you can't always rely on that. But what I'm saying is this: if you have a meeting and you have an interview with the hiring panel, you email them only one time. You do not repeatedly ask them for feedback or ask the status of your application. You do not do that. You only do it one time. You thank them for their time and you move on. You continue to apply. And you continue to get those interviews and things. That's what you do. That's what you do with your time. You don't repeatedly go back and forth. Because again, if I had somebody pestering me like that, I would not hire that person. Doesn't matter. Because you didn't follow the social protocol, which is you only do that once. You don't repeatedly ask for feedback, because it's not required of them to give you feedback for those exams, those little assessment tests. I'm just saying. So with that said, I'm about to run out of time, but I do want to say this. If you're out there, guys, that is one of the most important things that you have to know, is that resume has to be right. That's number one. Number two, you are applying even though they're asking for experience, because if they are saying in that job listing that this is for a medical coder, this is where you have training. This is where you have training. And so you want to make sure that you are submitting your application. If it gets automatically denied, then you need to print off a copy of your resume and your cover letter. You need to mail it in to whoever's doing the hiring, so that way you can get your resume in front of them. And you can say, I did apply online, but I just wanted to follow up with a paper resume. I really hope that you'll consider and, get back with me, or not get back with me, but hope that you'll consider my application. I look forward to speaking with you. There we go. It's late and I'm doing these videos. So, but yes, that's how you know my videos are never scripted. But that being said, that's what you say, and so that way give them the choice. But again, you continue on with your journey, and you continue on until somebody gives you a chance. And don't indiscriminately apply. You make sure that your resume reflects whatever the job title is for that position, for that facility, for that organization. You do that, because otherwise it's just going to look like you're just blanketing resumes, and just whatever pasta sticks to the wall, that's what you're going to do. I wouldn't want to hire you either, because that shows, what do you know about our facility? You're just trying to get in anywhere. You don't care where you apply. And I'm not going to want somebody that's like that. I'm going to want somebody who, okay, this is somebody that knows what our organization is about. This is somebody who wants to work here. And even though you're applying for all these other places, they don't need to know that. They need to be treated like they are the only one that you're applying for right now. And until you get an offer that's what you do. You keep applying and going to all these places. So that way you can get in front of the right person and you can find your start. And your start may not be your forever home. I'm just saying. With that said, best of luck to you guys out there. I've done plenty of these videos. Please go back to my videos and watch. And good luck to you guys. And again, if you need a recommendation, go on LinkedIn or see the description box below. With that said, I'm going to wrap this one up. Thank you guys for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all again. Bye.